Thank you all very much for joining us. We're going to wait a few seconds as the folks who are joining us through Facebook and Twitter and our other platforms begin to log on. So I'll introduce myself twice. My name is Andrew Romanoff. I used to be the Speaker of the House in Colorado. I was the president of an organization called Mental Health Colorado. I left that job last year to join this race for the United States Senate. I'm hoping to replace Cory Gardner, and you can learn more about our campaign at andrewromanoff.com. We're holding virtual town halls like this every Friday at noon Mountain Time and every Tuesday at 5 p.m. You can follow these town halls by going to andrewromanoff.com/live. And you can also see replays of previous town hall meetings. I thought I'd start before we get into the topic today with a little bit of breaking news from the campaign world. As you know, we've had a very competitive race for the Democratic nomination for the U.S. Senate. Ballots go out in just a little more than 5 weeks, so around June 9th. The primary itself takes place on June 30th. But one of my competitors for this race who won't be on the ballot, Diana Bray, has endorsed me now, today. And I'm really honored to have her support. She is a climate champion and a psychologist who has done more than anybody in this race to put front and center the issues that concern so many of us around environmental justice and fracking. A real point of divide, both in the Democratic primary that we're having and obviously in the general election where we're all hoping to replace Cory Gardner. So I want to say to my friend Diana Bray, thank you for your support. It means a great deal to me. I'm honored to be joining you in this journey, and I hope we'll have more to celebrate in June and in November. Today, it was supposed to be a day for celebration. It is International Workers' Day, but it is hard to celebrate when you see so much of the news about working conditions here in Colorado and across the country, particularly the conditions that have come to light in Greeley at the JBS meatpacking plant. Some of the folks who have been leading the fight are joining us on this call today, including representatives from UFCW. I'll introduce Melissa in a moment. But I want to say particularly thanks to Crystal Rodriguez, who is a brisket trimmer at the JBS plant. She joins us from Greeley, along with Ruben Tim Martinez, who's a journeyman meat cutter. He works in Lakewood. I want to say to both of you, thank you. And I also want to say thanks to Melissa McAllister, who's the political liaison for United Food and Commercial Workers Union Local 7. So thanks to Crystal, to Ruben Tim, and to Melissa. Thank you all for joining us. I want to start just by asking Crystal, if I can, what life is like for you. But let's talk a little bit about what your working day looked like before the pandemic hit. Tell me a little bit like what happens when you get to work and what it's like in that facility.
It's pretty calm, like nothing was happening at the time, like a normal work day. March 20th is the last day I worked there, and it was pretty like a normal day, no precautions, no virus or nothing going around there that we knew of. Like we weren't told there's people infected with it there, so it was just a normal day, and at the end of the shift, like they started passing out bandanas so we could put on our face, but like just a normal day, nothing happened, like a regular get ready to work hard.
So what does a normal day look like for those of us who haven't had the job that you're performing? And I want to say thanks for what you do, because you're working hard so that the rest of us can eat. You shouldn't have to sacrifice your health or your life for that. But like what happens when you go to work? Like what do you do? What's your job entail?
I trim fat off brisket and do special cuts. So cut it into 4 different kinds of cuts that the customers want, and all day long. So like 2,000 to 3,000 pieces are coming down the line, and me and my coworkers have to pull off the conveyor belt and trim them to whatever cut we're doing at that time.
Do you get breaks throughout the day?
Yeah, we get a 15-minute break. That's not really 15 minutes, because by the time you take off your stuff and head downstairs, it leaves you with like 5 minutes to go to the restroom and to eat, and then go back up to the floor. And then we'll get a 30-minute lunch. And the same thing, like just it takes you a while to take all your equipment off and get down to the floor to have your breaks.
Is the place where you work, I'm just trying to understand like what it's like to work there because I haven't done that job. So is it hot? Is it backbreaking? Is it tiring? Is
It's
it?
a cold. It's like working inside a giant freezer. It's pretty cold, and you're only well, you have jackets and stuff, but it's like working outside in the winter basically, and cutting meat like frozen, bloody meat all day. Like I don't know how to explain it.
Is
It's
it pretty
hard to
slippery?
explain. Yeah,
I
it's
mean,
slippery. It's wet all over the place because they have to clean the floor after we leave, so it's wet and then bloody, and I'm not sure what else to say about it. Just
what? And I won't press the
dirty
point. I mean,
job.
have you ever gotten injured yourself on that job, or know other folks who have before the coronavirus crisis hit?
Yeah, you work with knives all day, so a knife in your hand all day and a hook, so they get hurt. Like physically, their hands will get deformed from holding the hook and the knives in them, and like some people get cut and some pieces could fall, and people have gotten hurt that way too.
Yeah, I can imagine that. I mean, it's hard for people who haven't done that kind of work to imagine it. How long have you been working there?
I've been working there 8 months now, but it's been kind of a off and on job for me
Yeah,
throughout since I was 18. I've been working at jobs like those, from the lamb plant to the beef plant.
I want to come back to what it's like now that the coronavirus has hit. But first, I'll just switch to Ruben Tim if I can. You're in Lakewood. You're at Safeway. You're a journeyman meat cutter. Tell
Yes.
me a little bit about like what it's like for you, like when you go to work. But putting the coronavirus aside for just a moment, like what's your day look like?
So, you know what? We go in there, we go in there and start cutting meat. Basically, we fill up the cases, make sure it's full and plentiful for the customers. Okay. We got chicken, pork, and then you got lunch meat. You got to fill that up too to make sure, like bacon and bologna and all that, make sure that's full. You know, it's hard work too, because now people are starting to buy a lot more meat because of what's happening up in JBS. I mean, we're running out of stuff up there.
Because people are stocking up in case the
They're
supply runs
stocking
out.
up. Right. And we don't know. It's just like the toilet paper. Now it's meat. They're scared that we're going to lose. We're not going to have enough meat out there. Chicken,
What were
pork.
before the pandemic? What were the safety precautions? Have you been injured, or I mean, how
No.
safe is your working facility?
We're pretty safe. We're pretty clean and we're pretty safe. We make sure everything's clean. After we get done cutting, we have the one guy at the end of the night just clean the blades. We have our own knives, so we clean our own knives.
Right.
So, but we, the grinders, the saws. So we get the primals from JBS. We cut them down to T-bones or whatever, ribeyes, and so forth.
And now that the pandemic has hit, I'll ask you, and then I'll turn back to Crystal too. But Ruben Tim, so like, when did your precautions change? When did the pandemic hit your workplace or change the way that you go about your day?
Well, we were pretty good there. It just seemed like we had to be more. It had to be more cleaner. You wanted, because we know this COVID-19 is just it's there. And I up in Greeley and JBS, I toured that facility up there, and I tell you right now, they're 6 feet apart. There's no 6 feet apart up there, right, Crystal? You know that, right?
Yeah,
You see that?
it's not. Yeah.
And
Chris, do you
And
do you
you're
want to
not
weigh?
allowed to wear anything on your face. You're not allowed to wear face masks. You're only allowed to wear a beard net, helmet, and some glasses, protective glasses. And so the face covering thing should have been entered into the facility when they heard this was going on in the outside world. Like they should have brought that into the facility so that we could all have been safe. But you're not allowed to wear. A lot of people wanted to wear the ski masks because how cold it is in there. But if you think about it, if they would have let them wear that stuff, it could have protected them and saved some people's lives if they would have allowed all that in the beginning.
So workers actually asked to protect themselves and they were told they couldn't?
Yeah, you're not allowed to do that. You're not allowed to cover your face, only with the beer nets that are to their level of sanitation, I guess. I'm not sure, like,
A beard
why
net's
they
not,
want to.
I mean, a beard net's not going to keep the virus out, right? I mean, if it's the
No.
same kind of net,
Yeah.
it's a net. So what was why did the company say that people weren't allowed to wear masks when they wanted to?
Because contamination, and I guess afraid of falling into the product.
Let
So
me, can I
that's
just,
what they
I'm going to come back to you in a second, but so Melissa McAllister, you're political liaison for Local 7. What, I don't know where to start, but so you got workers who actually want to protect themselves. The company says they can't. Is this something you've encountered before? I mean, not unless you go back 100 years, you're not going to encounter a pandemic like this. But have you seen these kind of policies, not just at JBS, but at other workplaces and plants?
Well, actually, when the pandemic first broke out, some companies that deal with customers directly, like Safeway, were not allowing masks at all from their employees because they were worried what the customers would think, and that the customers would think they were sick. So they were not allowing masks, and which is now obviously become mandatory. But and there are often like USDA regulations and rules that could affect something like that. Certain departments in grocery stores, they're not allowed to wear, jewelry or things on their face or nail polish or things of that sort, so it wouldn't affect getting the product. And so, yeah, it's not completely unheard of.
What Melissa, Crystal had started by telling us about some of the conditions even before the crisis hit, and the dangers that exist in those facilities, especially with dangerous equipment, with slippery floors, with hazardous chemicals we haven't talked much about. But can you tell us much at all, if you're comfortable, about the sort of workplace safety compliance record at a place like JBS? Were they been cited for any violations, or was it how do they rank among sort of companies in this line of work?
Well, I mean, it's a dangerous place to work. Like Crystal's saying, they're working with hooks and knives, and I mean, there's cow carcasses floating around the facility. I mean, there is a line, so you have to keep up. You have to do a certain speed. We have 4 people on staff that are just solely representatives for the JBS plant. So we constantly have our staff inside of the facility. And we also have walking stewards who are workers inside the plant, who are representatives of the union as well. So we are constantly monitoring the safety inside the facility. So it's much better off than places who don't have that kind of, don't have people constantly watching them. I mean, there are government bodies that are there to make sure that they're safe, but unless you have somebody constantly in the plant or the facility, it's not easy to see what's really going on. So I think that helps a lot, is having just people in there. We have OSHA experts on our staff as well that they visit the facility to make sure they're working in safe conditions.
Were you familiar with the point that Crystal was making earlier, that imagine you were, but that workers are asking to wear masks to protect themselves, and the company says no? I mean, it strikes me as outrageous.
Well, I hadn't heard that, but that does not mean that's an inaccurate statement. Because like I said, I mean, Safeway said no to their employees as well. So they're not the only company doing it.
Let me just switch just on that point back to Ruben Tim then. So have you heard, so has that been your experience, Ruben Tim, at the Safeway where you worked, that people were trying to mask themselves and were prevented, or no?
No, what's going on is right now, because we got customers, and I'll tell you, my fellow coworkers, they're scared, okay? And they're scared because the customers are not coming in wearing masks. This is the issue we're having right now. All the employees are wearing their masks and everything else. But at the beginning, like Melissa said, they weren't doing it. Okay, they didn't say. But now we're like, what, a month in? Now they have to wear, the employees have to wear a mask. Okay, now we want the customers to wear a mask because there's a lot of people out there sick and they're coming in without masks. And that's an issue we're dealing with over there. And then my fellow coworkers are scared.
I don't blame them. And the place where I work, the compliance with this mask, it's not a requirement, it's just a suggestion. Seems like 20% of the customers. I don't know what your guess is where you are.
Yeah, I'm not sure on that, but all I know is we still see them in there. They don't, some people don't care. I mean, they don't care about where, they don't, I feel like we're frontline workers and they know it and they don't really care if we get sick. I don't get that part. And we're doing, you know, like we're providing essential services, you know, stay stocked, open for business. You know, I'm happy to do my part, but I also want to make sure that my workplace is safe for myself and my coworkers, and that we feel safe enough to speak up if something could jeopardize our health. You know, we can all work together and we can get through this crisis. You know, but right now, we need those masks for the customers too to come in.
I don't blame you. And listen, the president issued an order declaring the reliable supply of beef and pork and poultry to be essential part of America's critical infrastructure. But the human beings who are producing this seem pretty critical to me too. I want to just to turn back to Crystal. And again, I want to say thanks to all of you for joining this conversation. I know there's some people who are joining the Zoom call or the going to andrewromanoff.com/live and joining us and sending in some questions. So I'm going to try to get through some of those. A lot of folks, Crystal, who are joining the call are asking about this issue that you raised. And I just want to walk through this. So when the company said no to ski masks or anything more than these beard nets, did any of the workers quit, or what was their reaction? What was your reaction?
No, everybody's afraid to lose that job because it's a pretty decent paying job. Like, it's not the best out there, but it's pretty decent. Like, when you don't have an education, when you don't speak English, when you don't have like a lot of people come like refugees and stuff, like it's your only option basically to make that kind of money there. Because I would make pretty decent money, like from $600 to $700 a week, but still that money to me is not worth my life. Like, if their precautions that they're taking now actually I think aren't good enough, because I was like not showing any symptoms and I just tested positive myself. So if I went to work without taking a test and showing that I was positive, if I walk through those doors with no temperature and go infect how many people that I wouldn't even know, like that I infected myself, like I think that's a stupid precaution that they're taking in their part, because I had no temperature. I still have no temperature. Every now and then I'll get one, like I'll start feeling warm, but how are they going to know who's sick and who's not by just taking temperatures? They're setting themselves up for more death and more sickness.
Can I ask you about that? Because there was some news just not long ago where Cory Gardner was talking about the efforts that he and Mike Pence, the vice president, were making to get testing. So what's the situation at JBS with respect to testing where you are? Have you been tested? Have other folks been tested?
Well, they said that they were going to test everybody, invest this $1 million or something into testing all of the workers, but the next day it got canceled. So they only tested 40 supervisors, I heard, and the supervisors came back positive. So that's when they called off the rest of the testing, I'm sure, because they're afraid of how many more numbers were going to come back positive. And so like now I heard it's like from 200 and something people that are positive right there. So imagine if they tested all the rest of the 6,000 workers, how high that number would jump. I think that's their fear.
But not testing people. Yeah, no, I take your point, although of course not testing people doesn't make the problem go away. It just makes us blind to it. It's like turning up the radio in your car when your engine is knocking it. It's still broken.
Yeah.
What can Melissa? Go ahead. Sorry.
No, it's fine. Go ahead.
But Melissa, can you put some numbers on this? Because I know, and I should have started by acknowledging this, and that 6 employees now have died from COVID at the JBS plant in Greeley, as I understand it. And as Crystal was just telling us, a couple hundred have tested positive. Since not everybody's getting tested, it's reasonable to expect that the real number's probably higher. Can you shed some light on that for us, Melissa?
Sure. And just to clarify, I did get a union representative from the plant did let me know that she is accurate and that the company was refusing to allow them to wear masks at their request. So that is true. It is confirmed. So yes, we just had the 6th member of ours pass away from COVID at the plant.
So
the
sorry.
positive cases went. I know it's terrible. The positive cases went from 120 to 245. The testing that Crystal's referring to was supposed to be done over Easter weekend. And they began the testing on Saturday. They tested the management. The original plan was test management first. And as we understand, it was testing over 40% of the managers that were tested were positive. So they abruptly stopped the testing and did not continue on to allow the frontline workers, our members, to get the testing. Although prior to that, when they were going to close the facility because of after the 3rd death, they did say they were going to make it mandatory for workers to get tested before they even came back to work. And in that, they didn't say how it was going to happen, if they were going to provide it. They, like I said, those 2 days they did provide it, it was very limited amount of people. It was only a couple of the shifts. Well, it was 2 days, the April 9th and April 10th, and then it was only a couple of the actual jobs in there. It wasn't going to be tested for everybody in the whole plant. So it still wasn't going to test everyone. And so since then Weld County had testing for people, but it was only for people who had symptoms. And it wasn't provided by the company. That was a county deal. So it's just, we have no idea really how many people are infected.
Let me just kind of I appreciate what you're sharing with us, and I just to walk through a couple of the points you made. So first of all, what was the rationale, if you know, for testing the management first?
I honestly don't know what the rationale was. I mean, maybe Crystal has some more insight. I'm not sure if that was a premeditated or if they had, I don't know if it was, I'm not sure.
Crystal, do you know the answer to that?
No, I don't know about that either. I just know a lot of my fellow coworkers were upset about that because we think we're more like out there to get the virus. Like the supervisors and the management, like they're more put away, but we're all like huddled up together all the time. And they could like separate themselves, but the workers that are working on the line, we're all together, like every day, like elbow to elbow working conditions. That's not their case. I think they should have started with the employees first and not the management, but we're not sure why they did that.
Yeah, and I know Ruben Timmon mentioned the same thing. So you're not 6 feet apart even now from, are you any feet apart? Like, are you literally touching your colleagues? What's it look like there? I mean, sorry, Crystal, how far apart are you from your coworkers? Yeah.
You're still the same, except for they put plexiglass like on the sides of you in the front. So I don't see how that's going to help, because from what I heard about the virus, if somebody coughs and sneezes, it spreads like up to 6 to 13 feet away. So I'm not sure how that's going to help.
Well, it's not like you're in a plexiglass cube, right? I mean, it's just a divider.
Yeah.
So,
yeah, just a divider.
How tall does it go?
I would say about like probably 5 or 6 feet. I'm not quite sure, just on the sides of you, because you're standing up on a table, on a metal stand on this big huge table, so it's just like in between you.
Right. So it's about your height basically. So you could, I mean, the virus could jump over that. I'm not a medical expert, but that strikes me as not good enough. What
it doesn't seem good enough to me either.
No, I got nothing good to say about any of this. And I want to talk a little bit before we're done about what we can do as people here in Colorado to help save your lives. The least we could do, not just because it's International Workers' Day, but because you're human beings. Melissa, you said earlier that when the tests came back positive for a lot of folks, the answer was not to test everybody, which you'd think might be the right approach, but just to stop testing. Did I hear you right, Melissa?
That's what they did. I don't know the rationale behind that, but that's certainly what they did.
This is
testing.
I mean, this is a family show, so let me put this more politely. Like, what the heck? What do you want? I'm not. I don't mean to be too cute here, but like, what's the rationale for stopping testing when you find that the problem seems to be widespread?
I have no idea. I'm sure it has something to do with them not exposing the real numbers. I mean, 6 deaths out of 240 people tested, 245 people tested positive. That's crazy. There's got to be more people. And they're working, like she said, you're working elbow to elbow all day long next to people. And you go to breaks together and you go to lunches together and you know, everybody comes in the same time. There are multiple shifts, but you know, thousands of people come in the same time through a tunnel that they're enclosed in, and they're all walking together. So I have no idea why they wouldn't test it. It seems not only necessary, it seems like just really, really not compassionate not to. I don't know why they wouldn't do it.
Can you put, you said 245 or so positive cases. What's the total number of folks who are working in the plant?
There are about 6,000 that work there, and we represent about 3,000 of them.
And since we're not testing everybody, we don't know what the actual rate is. And since a lot of people who have this virus don't display symptoms, we can't just sort of look at people and know. You got to actually test them, right? Do you have any sense that you were going to jump in there, Crystal? Do you have any?
Yeah, like the temperature thing, yeah, that's not going to work because you don't always get a temperature with you could be like that asymptomatic or where you don't show signs, but you still have it. I think that's what I kind of am. And I could have went to work, like I said, and infected everybody. And I wouldn't have known and they wouldn't have known because they're not testing anybody. And like, I just want to say, I know 2 friends of mine that their families are on the ventilator right now, fighting for their lives, still going on 29 days now on the ventilator. So, and my dad's friend Saul, he just found out about him because I don't know if I mentioned this on here, but my dad just got off the ventilator on April 13th and got released on April 18th.
Does your dad work at JBS too, did you say?
Yes, my dad's worked on the fab side in the laundry room, and he got infected on March 20th. He became ill at work. And but it was time for him to go home. So like he went straight to urgent care and they told him to quarantine and stuff. And so he did that for 14 days. And he didn't even do that for 14 days because on the 5th day he got really bad, couldn't breathe. And he was admitted into the hospital on the 27th. So they finally like kept him there, and then April 2nd put on the ventilator, and April 13th got off the ventilator. But on the 2nd, we almost lost him. They're like, we're sorry, like, we don't know what to tell you. Like, do you want to come in here and we can make your dad comfortable, and so you could come tell him goodbye. We can move him to a separate room. They were going to move him away from everybody so my mom could go say goodbye to him. And she's like, no, keep him on the ventilator. And if he stops, something goes wrong, like resuscitate him and keep him on the ventilator because he's not done fighting yet. And so like they did, and we went to go pray for him and stuff, and like a few hours later got a call he was stable again, and he fought the fight till the 13th. He got off and released on the 18th. So luckily my dad's back home, but like his friend Saul Sanchez, he didn't get that chance. You know, he passed away on the ventilator, and it's pretty sad to see his family, and it's pretty sad to see my dad crying for his friend that he known for. My dad's been with the company JBS 38 years. His friend Saul was there 30 years, and they known each other that long, and it's just it's sad, you know, to see this happening, something that could be a like we could have been protected, they could have been protected, they could still be here, but the stupidity of the company didn't allow that.
I'm so sorry. Tell me again the name of your dad's friend we lost.
Saul Sanchez.
I'm sorry. I'm sorry
Yeah.
to you and to his family too. I'm very sorry. How's your dad feel now? How's he doing?
He's struggling still. He lost 35 pounds on the ventilator, and it really took a toll on his body. Like he never used a walker before, and he has to use a walker now for support. And he's just so like skinny, and his face so sunken in. It's crazy what this sickness does to you, and just took a lot out of him. He's really weak and needs my mom to help him take a bath and stuff, and something he never had before. Like my dad's been a really strong, like active guy, and now to see him like that, you know, it affects me and affects my family greatly, and I'm sure it affects him greatly because he's been going through a lot of issues on his own. But I feel a lot of anger in that, because this all could have been prevented. Like these people on the ventilator fighting for their lives right now, this all could have been prevented if they would have took the right precautions in the first place. And the precautions that they're taking now need to be better.
I want to talk about that exact issue. But first of all, I want to say I'm wishing sounds like your dad is a fighter, and he's got your mom sounds wonderful too. And I hope. How old's your dad? How old is he?
He's 58.
So
58.
Yeah, got it. I'm wishing many more birthdays for you all to celebrate with him, and I'm glad. I know he's not out of the woods, but I really thank you for sharing that story, and my heart goes out to the family of your friends that we've lost. I want to ask just one quick question for Rube and Tim, and then I'll turn to all of you to figure out what we do next and what precautions, as you were saying, Crystal, we might take. But Rube and Tim, with respect to your workplace, is there testing? Have there been positives? Have there been, God forbid, any deaths where you are, or among other folks you know?
There hasn't, Andrew. There hasn't been. You know, we're pretty lucky in there. You know, some of the family are getting sick. You know, the kids are getting colds, but nothing like what's happening in JBS. I think Melissa could ask that. I think, what do we have? 7 positive in Safeway throughout the whole Safeway Albertsons. And then what, King Supers, we have 27 positive, something in that area there, but we don't know if it's going to go up. Okay. Like I said before, we're essential workers. I mean, the grocery stores, people need to have food, you know, they have to have the things to have. So they're more at risk too. Just like JBS. JBS, my heart goes out to you guys, I tell you. You know, I've been there, I've seen that. I've seen where you work at, and it's something. It's something. And you know what? Lucky we have you people there to fill the grocery stores up.
Absolutely. I appreciate you saying that, and I appreciate what all you're all doing. So where do we go from here? There was a move, Melissa, on the part of UFCW to shut down the plant until the right precautions and testing and conditions were in place. Obviously, the president, as I mentioned earlier, ordered all the meat packing plants across America to reopen, even though it sounds like those precautions are not yet in place. So I'll just get the official line, I guess, from UFCW for a moment, from you, Melissa. Like, what do you want to happen next?
Well, you know, originally we were pushing for the plant to close in order to do proper testing and cleaning. It's certainly not something we want to see. We don't want to see our members not work, and we don't want to see the facilities closed and not make money, you know. So, but they do need to provide all of the things that were recommended by the governor and that Pence had said was going to happen. They need to be more of the recommendations. So they need to provide PPE, the highest level of PPE that they can, to our frontline workers, both the JBS and grocery store workers.
You're talking
They
about
need-
personal protective equipment, which is, I guess,
oh,
an
I'm
acronym
sorry.
everybody
I
knows
thought
now.
that
No,
everybody
it's-
knew what that meant now.
I think they do.
Yes, personal protective equipment, and whatever means that may be. You know, if it's the guards and masks and gloves and sanitizing stations and hand washing stations, then that's all what needs to happen. Whatever the CDC. Sorry.
Yeah, no, I want to pause here because that's a really good list of the things, Crystal. If you heard Melissa just list off the guards, the masks, the other precautions, which of those are in place where you are?
All of them right now, but before that, we would even run out of sanitizer. We would even run out of soap to go to the bathroom. You would have to go to the restroom and wash your hands with just plain water, and not even hot water, cold water, because they would run out of soap all the time. So if that tells you anything about the company.
When did that, how long ago was that happening?
It happens all the time there. Like, there's too many people going to the restrooms, and they always run out of soap and sanitizer to back up having no soap. So
Are you saying like
that's an everyday thing.
now? Like if you go to a restaurant.
Now I don't know, but back then, before all this happened, that was an issue.
That seems like a minimum, like having soap or hand sanitizer in that facility. So Melissa, I cut you off earlier. So so you're rattling through a list of things that CDC is recommending and that should be in place everywhere, I think. What else is on your wish list?
Definitely testing. These workers should have priority testing. They should do it as frequently as it needs. If they need to be tested daily before they can go into work, then so be it. But they need to be tested. I mean, this is a hot spot in the middle of Greeley, and as our president had said before, I mean, this could potentially be a death sentence to these people. This is going to work with sick people that may not be showing anything, and you just have to do it. So testing, I mean, that one's huge, and that should be the minimum that they're providing. Definitely all of the guidelines set by the CDC or any other health organization should be mandated instead of recommended. You know, President Trump requires these meat processing plants to be open now, and also gives them immunity to if there's a sick person or a death at these plants, that the company's not held liable for it.
We should pause on that point because I read that as well, and we'll try to devote another town hall to this question too. But so part of the president's order immunizes not the workers from the COVID, but the company from a lawsuit. Is that right?
That's right. That's right. And the communications that have come between us and JBS have often been unpleasant, and the most recent from the company was kind of a threatening letter saying, you know, so under our collective bargaining agreement, we have a no strike clause and a no work stoppage clause, which is very common. And so by us encouraging our members to not go to work sick, the company is construing into a violation of the contract, encouraging workers not to work. So essentially a work stoppage, which is not our intention at all. It's just to make sure that our members are going to a safe work environment, which is not an unreasonable ask.
It's not unreasonable, and I shouldn't characterize it as a wish list, because what you're talking about are basic necessities, especially during a pandemic. So let me ask you this just directly, and I'll put the same question to Crystal and to Ruben Tim. It sounds like some of the precautions that you all have requested and fought for are in place, but not all of them. So in your view, Melissa, or in UFCW's view, should the plant close now until those precautions are in place and the testing that you're asking for is in place, or should it remain open? I know it's a thorny question in the fight that you all are engaged in, but does the union have a position on that?
Well, like I said, we don't want the plant to close down. We just want to make sure these workers are working in a safe environment, which could be that you know, we as a union have access to everything that they're committed to doing as far as social distancing and slowing line speed and providing PPE. I mean, if we could work together collectively, we could nip this in the bud before it became a problem of closing the plant again. I think it's doable. There are some things that are wish list worthy, paid family leave, death insurance. These are things that maybe aren't required of the company, but we don't want to see the plant necessarily closed. We just want to make sure that the workers are working in a safe environment.
I would put paid family and medical and sick leave and hazard pay or bonus pay on the list of necessities too. And I know you're fighting for those as well. I'll just get your opinion though. Crystal, you're there. Do you want to see this plant closed for the time being? Do you feel safe?
I think they need to close down. They need to disinfect all of it in case somebody like me that doesn't know they're infected has been in work and working around all these people that aren't going to know that they're sick, or them themselves don't even notice that they're sick. And they need to test everybody, and then after they get the test back and that, maybe they could go back to work. But I think they did it the wrong way and just jumped back into work. Like, I understand the money part. Believe me, I'm not a rich person. Like, I'm struggling myself, and I just think that would be the smarter, the wiser choice to shut it down, test everybody, and then get back to work. Hey, everybody loves money.
Do you have a view on that, Ribbon Tim? I mean, I know you're not working at JBS there, but
my thinking is that we, I don't know if you heard that today, where they said the danger zones, you're really more vulnerable when you go check out with your card, okay? We have glasses up, but it's just a little one. Now, I think the plexiglass, okay, they should extend that all the way out, okay? They have to do that because the little plexiglass doesn't do it. That's my thinking on this part. I think that makes more sense because you're dealing with your credit card and you don't know who has that on them, the COVID-19, okay?
Right.
And face mask. I think it should be mandatory.
Mandatory for everybody, workers, customers.
Customers, more important because we do have the masks for the employees. We need masks. The customer has to come with some masks, I think.
Yeah.
And I think that's good.
Doesn't seem to be any rhyme or reason right now. I see folks shopping, and sometimes the mom will be wearing a mask and the dad won't, but they're shopping right next to each other with their kids. And this just seems like a suggestion at the moment, and even the president himself, of course, said that he didn't feel like wearing one. And then the vice president toured a Mayo Clinic without a mask, first because he said he wanted to look the healthcare workers in the eye. He said it's like he's a little unclear on where the mask goes. It'd be funny if it weren't so dangerous. I want to turn in the time we have left, and I'll start with you, Melissa. But so we're all, I don't know how many folks are joining our Zoom call. We'll get a count from Seth in a moment, but there's a lot of folks like me who are furious, just like Crystal said she is, because of the conditions that people like Crystal and Ruben Tim and others are working through, especially at JBS. And we don't want that to happen on our watch. I'm not in office. I don't have any authority. I just have a platform here. But tell me, if it were up to you, what could somebody like me or anybody who's watching, Melissa, what can we do to help?
Well, I would say contact your elected officials. At this point, that's kind of the pressure that the community could do, because it's not something where, Crystal and her coworkers are directly working with customers. And so there's not really an impact people could make, internally or directly to the actual plant. But I think that, contacting elected officials and talking about how because this is a concern for all of us. I mean, in Greeley, there are 23 different languages spoken at that plant. There are so many various kinds of members in the community that work there. And if they're sick at work, they're going to be sick everywhere they go. They're going to be sick in their temple. They're going to be sick at the library. And I know, with social distancing and things and the safer at home order, we're not going to a lot of public places, but you're still amongst people at the grocery store and things that are open for essential reasons. And so I think just showing the love and support to the workers there and yeah, contacting elected officials to put pressure on them to do the right thing.
I want to just spell this out in even more detail because, you know, I go outside at 8 o'clock each night to howl with my neighbors in support for healthcare heroes and other frontline workers. And I feel like howling right now, given everything that you all are describing. So Melissa, when you say contact our elected officials, if we wanted to take Ruben Tim's advice and turn the mask guidelines into a requirement, which makes sense to me. If we wanted to take Crystal's advice, even if the plant's not going to shut down, at least to put in place all these CDC guidelines, I know the president's got his order going out, but who in Colorado is capable? Is it the governor we should be calling? Who should we call with these requests?
Yes, I think it starts with the governor. Definitely. He's the one that has the authority to make it mandatory to wear masks. And he did write a letter to JBS, and he was involved when they first shut down the facility. And it was all really positive, but unfortunately they were recommendations and they weren't mandates. So the company did what they thought the minimum that they had to do, and they weren't held accountable. So yes, definitely the governor has the power to implement these things in the facilities.
And I'll get Seth maybe to put up contact information for the governor's office. Seth tells me, by the way, that we've got at least 1,500 people joining this conversation. No pressure. I didn't want to break that news to all of you until now. But if you had, Crystal, I'll turn back to you for a second. If you got 1,500 friends who were joining you and standing with you and wanting to protect you, what would you tell them? You have a chance actually to tell them that. Forget about me for a second. I'm your friend too, but talk to these 1,500 folks. What do you want them to know and what do you want them to do?
Wear a mask and protect yourselves to protect your family and potentially protect somebody vulnerable, like an elderly woman grocery shopping that doesn't have nobody to protect her. Like, do it for them. Like, wear the masks for him, for Ruben that works in the store. Like, protect everybody, protect each other, and just be like, I don't know, more cautious of what you do and just be safe, the safest you can out there.
Thank you. Ruben, I'll ask you the same question. You're speaking literally to 1,500 people right now. What do you want them to know or do?
You know, like I just said before, and I'm going to keep saying it, and anybody I could tell, wear a mask when you come to shop, okay? Be 6 feet apart, and respect that, okay? Wear a mask when you come to the stores, and say hi to us. Don't be scared of us anymore.
That seems like good advice. Melissa, where does this fight go from here? What's the status of the negotiations? I know we did mention it earlier that one of the steps CBS took was to tell you and UFCW to cease and desist from some of these media activities, right? I'm sure they're not thrilled about this conversation that we're having right now, but can you just walk us through the next steps?
Well, I know that our union president actually is at the facility now, so we're hoping that we can find some common ground and work together to protect our workers. This doesn't have to be a fight. This could easily be it could be a really, really good way for us to work together. I don't know, day by day, hour by hour, things are happening. And it's really hard to say what the next step is. I know we're going to continue to pressure the company to do the things as we've discussed in this town hall. And I think our biggest worry is that this spreads and continues, and it doesn't get any better. And then we kind of just want to ask the company, what are they going to do? What are you going to do if you have 3 more deaths next week? And if you have 200 people more that are tested positive in a couple of days, what are they going to do? I mean, hopefully they come to their senses and we can figure this out together. But honestly, we're just taking it one step at a time. Hopefully we can have civil conversations with the company instead of bantering, because it's not getting us anywhere.
Do you have any way of knowing whether the conditions at the JBS plant in Greeley are better or worse than the conditions in similar facilities around the country?
You know, I've basically heard the same kind of things that everybody else has. I've seen articles, I've seen news broadcasts. It seems like there's a similar problem. I do think that we've put a lot of pressure and brought a lot of attention to the JBS plant in Greeley, which unfortunately I don't think other plants have had that luxury of. So I think that there's more pressure, so we're a little louder about it. So I think that they're starting to make some moves. I did talk to a union representative before this about different things that were happening. They're trying social distancing. They're trying, like she said, putting up the protective shields. They're trying to stagger the breaks and lunches a little more. So it's progress, but it's baby steps compared to these big leaps we need to make.
Yep. But I I agree with what you just said too. I think if you're in the middle of a pandemic, baby steps don't do the trick, and it shouldn't take 6 deaths to tell us about these dangers, or a near-death experience like happened to Crystal's dad. To Crystal and to Rib and Tim, one of the things that Melissa was talking about earlier was paid leave, family leave, medical leave, sick leave, hazard pay, bonus pay. Can you tell us at JBS or at Safeway for that matter, what those policies look like for you? Do you get any of those things?
Well, on Safeway, it's, they gave us a $2 more, okay? And I think they extended
$2 an hour more?
$2 more an hour, yes. And that's everybody, the whole store. I think it goes till May 2nd. Am I correct, or is it a little longer, Melissa?
I think that's the last we'd heard, but it's certainly not a certain end date. We're just working through it as dates come about.
Right. So yeah, that's one of the, that's what they did at the beginning. So, Safeway was one of the first ones, and now King Soopers implemented the same thing.
$2 an hour. That was
$2, and I'm not sure what else they get at King Soopers, Melissa. I'm not sure on that, what they're getting.
They had received a bonus in lieu of a hazard pay for the first couple weeks. But since then, they have done the hazard pay the same that Safeway's done, the $2 more an hour.
What about paid leave at Safeway?
They did offer 14 days paid leave if you had a doctor's note relating to anything COVID related.
Could it be a relative who you're trying to help?
It could be only if it was a doctor's note saying that you had to, or it was so severe that you couldn't go to work. So it was only if they were providing doctor's notes. So it wasn't really very common that they could take off to because of a family member who would be more susceptible to contracting the disease.
I've got friends who've contracted the disease, and 14 days doesn't always cover it.
No. I mean, after that, they are allowed to use their sick pay, vacation day, personal time, but the company only pays the 2 weeks.
Crystal, what's the policies? Can you speak to that at all at JBS? Like, how long was your dad in this fight? And what's the lead time for him?
May 20th till now, and I actually have a problem from them not paying my dad again. They paid him $37 on his pay card that he gets paid with, so they only paid him $37 yesterday. And so I'm gonna have to talk to somebody about that, because I don't think that's right. 38 years and they're gonna do him like that. I don't think that's cool. But so I'm not sure about the pay, but I know they give you, like, I think they said that you could get like 4 days or something paid sick, and then I'm not too sure about that, but they don't really pay you if you don't qualify for a FMLA or something like that.
Did you mean to say March 20th till now?
March 20th, yeah, till now. So
that's a lot more than 14 days. Like more than a month, like 40 days or so.
Yeah.
Yeah.
And so I'm still working on that. Yeah.
Well, I would like to be helpful. I mean, I know we're almost out of time, and I know there's a lot of folks who would like to be helpful too. So it sounds like, tell me what all you want to add in the last 2 minutes here, but we could start even before anybody requires us to actually take Rib and Tim's advice and wear a mask everywhere, all the time, at least whenever we're going outside, and especially when we're shopping or coming into contact. That seems like something we could do without passing a law. But the second thing is to sounds like to take Melissa's advice and call the governor. And Seth has posted the governor's contact information on our chat feature, I think. I know folks are joining this conversation from different platforms, so you'll find a replay of this conversation at andrewromanoff.com/live. And Seth can tell me whether the governor's contact information stays there. In fact, Seth, if you text me that, I'll just say it out loud so the folks who are phoning in can have it. Or maybe you can just say it. Actually, you're not muted, are you, Seth? Seth is the voice of God in this town hall. So, Seth, tell us where people should contact the governor. How to do that, please.
Yeah, so you can contact Governor Poulos at his office at 303-866-2471, and I'll repeat that again, 303-866-2471. And I've done a lot of these calls in the past, so if you get a voice or a message machine, definitely leave a message. They will listen to those and respond to those.
Is there an email address that you found or posted by any chance?
Let me look into it. I haven't found an email address.
Okay, well, but at least we got the phone number going there. I want to say, because we're out of time, I want to say, Crystal, to you and to your family, and Ruben, Tim, to you, and also to Melissa and to your team at UFCW, thank you. But thank you, not just today, which is the day the world sets aside to honor Working People International Workers' Day, but thank you for what you're doing every day. I know this is not the first time in America, not by a long shot, that workers have risked their lives so that other people can eat. But I'm hoping with all my heart that during this crisis, and certainly by the time it ends, we can put a stop to unsafe practices here in Colorado and across the country. Nobody should have to sacrifice or risk her health or her safety just for the comfort of consumers. And it's time, I think, I know it is, that we had leaders in national office who understand that too. I'm glad the president is concerned about having a reliable source of food. I wish he showed the same concern for the people who are producing that food. And that's my commitment to you. I want to say again, thank you very much to all of you for sharing your time. I want to also say thanks to the 1,500 or so folks who joined us. I hope you'll take advantage of the resources that we're sharing. Reach out to elected officials, including the governor's office, and take the advice that our panelists have shared with us. We're going to be continuing these conversations again every Friday at noon Mountain Time, every Tuesday at 5 p.m. And if you want to get notified in advance of the topics, all you have to do is sign up on our website to get our newsletters. You can do that by going to andrewromanoff.com, andrewromanoff.com. I'm Andrew Romanoff, and I want to say thank you. I'm wishing you all well, and I hope you stay safe and healthy. Thanks for sharing your afternoon.
Thank you.
Thank you.